Excellent. Okay, so good evening, everyone. And am I the host? Can I just double check whether I'm host or not?
Let me make you the host.
Sure. Okay, excellent. And am I spotlighted? Just so that spotlight for everyone. There you go. Okay, so it's me. I've got the power. Okay. Okay. So yes, good evening, everyone. I am going to spend the next 50 minutes or so just talking about the basics of oral health and oral hygiene. I am, like Sukranti rather said, I'm a dentist. I'm an implant dentist primarily, and I teach undergraduates at Birmingham University. So this is a great initiative by the, I can say the Bhaktivedanta Medical Association, or the healthcare professionals of the Hare Krishna Society, ensuring that we have access to information about health. I think it's important to just make a note that whenever we're on a spiritual path, sometimes because we are wanting to be spiritual, we sometimes negate or neglect the physical or the material. And to a degree, that might be the case. We have to limit our materialistic life, but we shouldn't neglect our health. So it's almost like an artificial way of saying, okay, I'm being spiritual. An artificial spirituality is to be renounced from our own health. So we should look after our health, because our health is our wealth. Even our founder, Srila Prabhupada, said we need to be healthy to be able to do our spiritual practice. So health goes hand in hand with spirituality. So I would just, if just so you know, when I look down here to the right, my notes are over here on my right-hand side. So I'm just reading a few notes just to make sure I keep on track and keep on time. By all means, you can send in some questions. Please just do realize that I can't answer specific questions about specific issues that you have. Just try and ask the questions so they're relevant to the group. I will try and keep to time, and then maybe have some question answers at the end. So first of all, I wanted to say, maybe ask a question actually. So what is the importance for oral health to you guys? So maybe in the chat, if the chat is open, hopefully the chat is open. If you can just tell me, obviously I have an idea myself, but if you guys can just let me know what you think is important for good oral health. So let's see. And I just want to say hello to some of the people. Yeah, I can see my mum, my mother-in-law's on here. Kamal, hello. My wife's logged on, all these people. Some I do, Girish, Prerna, Damodar Prabhu. So yeah, the chat is open. So if you can answer the question, what is the importance of oral health? Let's start with something like that, and then I can go into what we're going to. Yes, avoiding bad breath, halitosis. Yes, that's a major one. It's quite antisocial when people have, yeah, essential for digestion. Yeah, it's the first part of digestion, maybe after cooking, or at least growing the fruit and veg nicely. Prevent expensive treatment. Yeah, avoid cavities. Yeah, good. So loss of teeth. So imagine prevention of loss of teeth. Avoid gum disease. Yeah, we'll be talking about that this evening as well. Longevity of teeth to old age. Yes, good. Health and well-being. Yes, it's very much connected with health and well-being, isn't it? Imagine just even having a little ulcer in your mouth can be so frustrating and annoying, let alone a big major problem in the mouth. Prevent cardiac problems. Yes, I'll go into the links between gum disease and heart disease as well, which we have now found. Okay, cool. So yes. So what I had, maintain good appearance. Yes, of course. Yes. Having a nice smile. Krishna has a nice smile, right? When Krishna smiles, he doesn't have any teeth missing, does he? Okay. So that's not to say you can't have a nice smile with teeth missing, because even Srila Prabhupada had some teeth missing, but it's still a beautiful smile. But anyway, Krishna has a beautiful smile with full of pearly white teeth. Okay, so I thought, yeah, the enjoyment of eating, tasting, that's important. Yeah, it's part of enjoying food, prashadam specifically. Aesthetics, smiling, comfort, being out of pain, function. So these are all things with the mouth. Speaking as well, being able to speak nicely. So I know as devotees, we all like to have some sort of premise or praman that everything sits upon. So I just thought of the Bhagavad Gita verse, Dehinosmin yata dehe, Komaram Yovanam Jara. Okay, Komaram Yovanam Jara. So Krishna is saying about these different phases of life. Komaram Yovanam Jara. And I'm going to use that as a framework to talk about oral health, because oral health is different in children. So some of you might have grandkids or kids. I'm guessing no children are logged onto a call like this, but there's a certain way of maintaining your oral health as a child, and then through teenage years and adolescence, yeah, Yovanam, and then adulthood, and then Jara, which is the root word of the word geriatric. So geriatric medicine and geriatric dentistry has a different approach as well. So this is what I want to try and use this thread as we're talking for the next 45 minutes or so. The next praman would be the verse which has tapa socham daya satyam. Okay, so this comes up in the Srimad Bhagavatam, which are the 4 pillars of dharma. Tapa socham daya satyam, 4 pillars of religion, we can say. Yeah, so socham means cleanliness. So cleanliness of our mouth, that is a spiritual practice. Therefore, okay, tapa meaning discipline, self-discipline of looking after ourselves. Okay, so socham is what we are practicing when we clean our mouths, right? And then there's a beautiful verse which I'd like to just expand on. It's never kind of left me, and that is from the Srimad Bhagavatam, Canto 6, Canto 6, Chapter 5, Text 22. And it stands out to me for a particular reason, which I'll get to. But in that verse, Narad Muni is talking about these vowels or these sounds, the swar, sa, re, ga, ma, pa, da, ni. These sounds can be formed into the holy name. Okay, and so just like we make a deity out of different metals or wood and everything, we can make a deity out of the sa, re, ga, ma, pa, da, ni. And this is the holy name. And actually, when I spoke to one of the saints in our movement, Ayendra Prabhu, I was speaking to him about this point, and he was reflecting back, and he actually said, yes, so in that way, our tongue becomes an altar for the holy name. So in a way, actually maintaining our mouths, keeping it clean with what we eat, how we maintain the cleanliness of our mouths, actually, this is where we are asking the holy name to descend into, so that our tongue becomes the altar for the deity of the holy name. So this is how we can link our oral health with our spiritual practice. Adabi Krishna Das said, which verse is that? Tapasocham Daya Satyam. That is in the story of Kali when he is cutting down the legs of the bull. So if you look that up, then within that there is the one line Tapasocham Daya Satyam, where it's talking about the 4 pillars of Dharma. Okay, hope that answers that. Okay, so we'll start off, like I said, Komaram Yovanam Jara. So kids, if we can get a child to go through their young years and their teenage years without having to have a filling, okay, then we stop them having a lifetime of dentistry. Okay, this is an important point. I'm going to just draw as we talk. So let's just let me just get that up. Hopefully, okay. If someone can just unmute and just confirm you can see this screen.
Yes, we can.
You can. Okay, good. Sorry, let me just do that. Thank you. Okay, so at the age of 6, right, we have the first molars come through. Okay, so this is a bird's eye view of the molars. Okay, and this is what are called the cusps, right? In between, this is a side view of it, okay? In some people, the cusps are very deep like this, and sometimes they're shallow. At age 6, when the kids don't have so much dexterity, they may not really clean their teeth very well themselves, but they're becoming a bit more independent. These teeth appear at age 6, okay? These are the adult teeth. They appear behind the final baby teeth. So we, as dentists, we say A, B, C, D, E, and then after E, there is the first molar, okay? This first molar, why this catches people out is because we do not lose any baby teeth before this comes out. And we're supposed to keep this first molar our whole lives. And this is normally the first one that gets decayed, okay? So at around the age 6, we need to be checking kids' mouths for this first molar to come through, because we've got to be brushing a little bit further back than what we realize. Now, in between the cusps, there is this little valley, and that can be deep in some people, it can be shallow in some people. If it's deep, then food can get stuck here, and this can happen all along here, right? All along this area. So that is how decay starts to grow inside a tooth, okay? So this decay can grow like this. So at around the age of 6 to 9 years old, we recommend, as a preventative measure, something called fissure sealants in kids of that age, because we can prevent, so this is the fissure, this area here where I'm scribbling, and we seal those fissures, especially when they're deep, or when a kid has had decay in their baby teeth a lot, okay? So this, if we can stop kids getting decay, then we can stop a lifetime of problems. So let me just go through that again. Like, let's say this is that molar, okay? So inside the molar, we have a nerve like this. So we might have a shallow filling like this, okay? So the kid might be 10 years old, they have a cavity, and they have to have a filling. Then what happens when you're 20, this filling might need replacing, or you might get some more decay, and then you get a bigger filling, okay? Then in the 30s, you might have more decay like this. Then 10 years later, we might get some more decay, and then I'll do this in red. So this nerve in here, once the decay goes into this nerve, then we have pain, significant pain. And then we need something called a root canal. Okay, or we need extracting. Okay, so what I'm trying to impress upon you is that at a young age, if we can just stop a small filling from being done, then 10 years later, you won't need a moderate size filling. 10 years later, you might not need a crown or a root filling or even an extraction. And then the expense of replacing it, or the kind of discomfort of things going on. Okay, so I'm just going to pause there for a second and just stop sharing. Okay, so that's just like at the very starting point. We've got these baby teeth coming through. Got these baby teeth coming through from age around 2, then to around 6 to 12, these loose teeth are all coming out, adult teeth coming through. So we need to have good oral hygiene habits. Okay, so I've just talked about a fissure sealant, which is important to seal the molars, and you can ask your dentist to do this, or see if it needs doing. So I'm just admitting people as I'm talking as well. Sorry. Okay, so that's prevention. And then sugar is another thing. So we live in a high sugar society. Now, a lot of devotees always say, can I have a toothpaste and don't use fluoride? Okay. Now, I will say, if you are going to not use a fluoride toothpaste, then you need to have a pre-1950s diet. Okay, I'll say that again. If you want to use a toothpaste that does not have fluoride, then you have to have the discipline to have a pre-1950s diet. Now, without going into the history of sugar, right, because I'll get into slavery and all that sort of stuff, we have cocoa, coffee, and sugar. And they were always given to the aristocrats, right? Then after the war, after sugar rations were lifted, then you have this kind of democratizing of sugar. And that's when, as dentists, we saw this sharp rise of decay. And then can you believe back then we didn't know what was causing decay, and we had to do, scientific research to go, oh, there is a link between sugar and decay. So in children, and now sugar is being it's been categorized as a mood-altering drug. Sugar is now a mood-altering drug. So if we're sedating people, we have to also work out how much sugar they have on a daily basis. So kids, if you're giving them sugar, it should be close to meal times, should be natural sugars that appear in the foods. Try not to add sugar to the milks. Try not to make squash so sweet, and definitely can't be having sugar before going to sleep. Okay, so these are kind of habits for kids. Okay, are there any questions? I've got my chat open. I'm trying to make it relevant, and I will go on to youth and old age as we go along. But just as a starting point, hopefully it is relevant to anyone who does have kids or grandkids, that prevention is first and foremost. All right, so brushing. So what we're trying to do is we're trying to eliminate plaque. Someone's put thoughts on sugar versus sweeteners where decay is concerned. Yeah, so sweeteners, we don't have enough research on sweeteners either, really, from a systemic point of view. But definitely, if there is a sugar addiction, then switch to sweeteners. But then I would even say we don't know what sweeteners do to our bodies. So let's just stick with fruits, maple syrup, all these natural syrups that we have that come naturally, and keep sugars close to meal times. That's what I would say. What if the kid doesn't allow? Yeah, okay, I was going to literally say that. Thank you, Krishna Kirtan, who is actually a fellow colleague dentist of mine. So how do we get kids to brush their teeth? Okay, so normally kids are averse to it. So you can imagine, I'm just going to come up to my camera. Where's my camera? There. Right, if I try and imagine I come at you like this, what does this feel like, right? This is an example of an adult trying to brush their child's teeth. It's very intrusive, isn't it, right? So I would say when you are getting your kid to brush their teeth, sit on the edge of the bath, have the kid in front of you, facing away from you, and then you lean over and you brush the teeth from behind. You can even have, if they need a screen, you can put a screen on the sink, let's say, or somewhere in the bathroom, of another kid brushing their teeth, right? And so it's not this intrusive, I'm shoving this toothbrush down you, right? You go from behind and you gently brush the teeth, and they can have a toothbrush in their hand as well. You can have a toothbrush as well, right? Or if they're copying you, then you brush while they brush, okay? And then you can, with little kids, I just say, look, we're getting rid of Jimmy Germ, right? We're getting rid of Jimmy Germ, so Jimmy Germ doesn't bite into our teeth or make holes in our teeth, make our teeth black, something like that. Whatever works with your kid, depending on how old they are. Okay, so that's probably a technique for, I hope that answers that. So frequency of brushing, yes, so definitely twice a day. The reason, why do we brush the frequency that we brush? It takes about 8 hours for plaque bacteria to grow. So we need to brush our teeth twice a day so that we are eliminating that plaque. Okay, so we definitely brush before going to sleep, because those fissures that I talked about, we're getting rid of the food from the fissures, getting rid of the food from the edge where the gum and the teeth meet, because that is where the plaque grows, this film that you feel grow. And if you have a lot of sugar, that plaque grows thick. That is what we're breaking up, and that is what we're removing, and that reduces the chance of decay and also gum disease. Okay, let me just read some of my notes. So habits of sugar, timing of brushing, brushing together, sitting together, like I said. There's something called bottle decay, that dentists call bottle decay, where parents are giving kids sweet drinks, especially sweet milk, while they go to sleep. And then you get something called bottle decay. You can Google this. It's when The kids' baby teeth all decay all at the same time. It's the biggest problem with kids, especially when people haven't got good habits. So essentially the kid is falling asleep with loads of sugar on their teeth. All the teeth, it's not just one tooth is rotting, literally maybe sometimes 12 teeth at a time are rotting. And unfortunately, if that happens, the kid normally needs to go have a general anesthetic and have all the teeth removed. Okay, so bottle decay, please don't be putting sweet drinks into bottles and then letting kids fall asleep with sugary drinks as they're falling asleep. And that will create phobias. So can you imagine a kid, and some of you might have experienced this, you get put to sleep with a mask, then you wake up, you've got mouthful of blood, all your teeth have been removed. And that is because we're counting it as neglect. So if you are, from a social services point of view, if you are not looking after your kids' teeth, it can be flagged up as neglect. So please do make sure you're making sure kids are brushing their teeth, and also the sugars are not being high frequency. Okay, a few questions. What about honey as a replacement sugar? Yeah, honey, you can have instead of refined sugar. It is very, it depends on how much honey. I don't want to just say, yeah, you can have honey and you're having like 4 tablespoons of honey. So I'm going to just assume that you are, sorry, that's a direct question to me. They've asked me. Which brand of toothpaste or toothbrush? Okay, so for a kid, we're still talking about kids. Just make sure the head is not too big. Can you imagine the adult-sized toothbrush in a child's mouth? It'll make them gag. They will fight brushing. So make sure the head is small. Make sure it's a soft to medium sort of bristle, so you're not hurting their gums. All the brands are pretty good. We're switching away from plastic. So if we can have, sustainable, that's better. I personally don't use an electric toothbrush. Don't kill me. I don't use electric. I use a manual. I've never used an electric toothbrush. I use a manual toothbrush. Touch wood, Krishna's mercy, I've never had a cavity. It's about being thorough with your cleaning. So all the brands are pretty good. You can get toothbrushes made from recycled plastic. You can get bamboo toothbrushes with bristles. Toothpaste, always make sure that the fluoride level is the right level for the child. So you can have, there's certain age groups and you have different levels of fluoride for the age, okay? And like I said, if you're going to use a fluoride, a toothpaste without fluoride, then you need to really not have a high sugar frequency at all. Like I said, a pre-1950s diet. I hope that helps. Hope that answers the question. Toothbrush. Did I say toothbrush? I said toothbrush. Toothpaste. Age appropriate toothpaste. And always spit. That was the other thing. Spitting out. You cannot let the kids swallow fluoride. You will get something called fluorosis. So if a child is swallowing their toothpaste, or even secretly going in because they like the taste of the toothpaste, going and eating the toothpaste, which is very common, then in their adult teeth, they'll get something called fluorosis, which is an abnormality in the development of the enamel on the teeth. And it's got brown and white mottling, like very weird pits in the teeth. So that is if you ingest fluoride. And there is other research for what fluoride, if you ingest fluoride, what it can do. So yeah, just be really wary about that. So I feel like I've covered everything for kids. We'll move on to teenage. Is that okay, Sukranti? Am I okay with what the pace is okay? Okay, good. And we're at past. Good. There are color codings on toothpaste like blue, red, black. Is there any one should avoid, or is this a myth? I'm not so sure about the color codings on toothpaste. It might be the fluoride level. Maybe another dentist can respond, or a parent can respond. But as long as you look at the age, then you know that, okay, that's got a certain amount of fluoride based on the brand. Okay, so we're talking about teenagers. So teenagers now, as you remember, in the teenage life, we start getting more independent. So that means if you're a parent of a teenager, you might need to check they are actually brushing. Sometimes they just miss out brushing. Yeah, I'm going to go brush my teeth. And they don't actually brush their teeth. And normally it's the nighttime one. And out of the 2 times that we're brushing the teeth, the nighttime one is the most important, because our saliva rate goes down when we sleep. and the saliva is a protective role against sugars and against cavities. So you do what you will with that. Either you got to go check the toothbrush, or you got to check the breath or something like that. But definitely with independence, you've got to make sure that they do value the cleaning of the teeth, whether you're using fear or understanding. Whatever works for your teenager, you need to do that. So the technique of brushing is called a modified Bass technique. Okay, so what that means is the bristles shouldn't be just perpendicular to the teeth. We should angle for the top teeth, the bristles should angle up towards the gum, and for the lowers, it should angle down towards the gum. And you've got to be brushing. Think about the surfaces. You've got the outside surface, you've got the inside surface, you've got the biting surface, and then you have the surface in between. So as teeth start becoming established, we need to start doing some flossing. Now, while you can floss in baby teeth, it's really important in teenagers now. So flossing should not be done when teeth are growing through the gum, but once they've established, that's when you start flossing. So imagine you've got teeth like this, okay? That's the biting surface. This is the side surface and the inside surface. Flossing cleans this bit here where the teeth touch, okay? What can happen is if decay, get demineralization in between, you get decay growing inside here, okay? So flossing can be done once a day at the end of the day to get rid of plaque from in between the teeth, okay? And that is a habit I would definitely say to start in the teenage years. Dental tape, dental floss, again, you've got ones that have got like a horseshoe shape or a bow shape. I would say, please try and use bamboo, so you're not got loads of plastic. So that's that. And then orthodontics comes into play here. So teenage years, the teeth come out, we call it the ugly duckling stage, right? I had braces for 3 years. So the teeth don't come out straight. Now the reason for orthodontics primarily is to help keep teeth clean and improve function. And the third one is aesthetics. Normally people go, I can have my teeth straight so they're nice, they look nice. Actually, that's third on the list from a dentist point of view. We want them to be straight so you can clean them well, and we want them lined up well so they are in a harmonious function, and then they look nice. Okay, so that's third on the list. Okay, so stability, function, and then beauty. It's like life, yeah? So orthodontics comes into play there. So around age 12, 13, seeing your dentist, when the baby teeth start going, start looking at orthodontics to then have teeth straightened so that, it's just better maintenance for a child throughout their whole life. And normally when kids have braces, they start developing a good oral hygiene regime because it's being looked at often. And these days, orthodontics can be the straight wire with train tracks, what we had, or we can have something called Invisalign. We can have removable versus fixed. So that's something you speak to your dentist about. So I want to talk about actual gum disease. So the technical term for gum disease is gingivitis, which is the inflammation of the gum. Gingivitis. Itis means inflammation, and then gingiva is the gums. So when we leave plaque on the edge of the tooth next to the gum gets inflamed. Now, if we see bleeding at the gum, then normally our knee-jerk reaction is to not brush there. But actually, it is a sign that you need to brush there more. Okay, so it's the other way around. We think, oh, there's some bleeding there, I'm not going to go near it. And what we do is we actually leave more plaque there and the bleeding gets worse. Okay, so we want to eliminate gingivitis. Gingivitis is reversible. So that just means inflammation. We brush up a little bit better. Within a few days, week, that can resolve just by cleaning better, okay? Again, towards the end of teenage life, we can get wisdom teeth coming through. Again, that can be checked. Sometimes they come through fully, sometimes they come through partially, sometimes they're totally impacted. Again, this isn't necessarily a major problem, but if they're halfway through, it becomes a more of a difficult place to clean, and you have different types of toothbrushes to ensure you're cleaning that properly. So again, to reduce halitosis, reduce decay, reduce pain, obviously. And then obviously your dentist will talk to you about that. So wisdom teeth around the age of 18 to 25, we'd say. Okay, so let's just check. I have so independent flossing. Okay, so we'll get into adulthood now. Okay, so what happens is this is what happens sometimes with patients of mine. I'll do an examination. Okay, so the frequency of an examination, I would say at least once a year. Okay, you should see a dentist. All right. If you have a higher risk, then the dentist will assess your risk and will say you either need to come every 3 or 4 months or every 6 months, maybe even 9 months. If you have low risk, it can be 1 year, even 18 months. Okay. So the frequency of seeing a dentist is not dogmatic. It's based on your risk. And remember, when we do a dental checkup, we are checking your habits. First of all, a good dentist will check your habits, check how well you're cleaning. We'll check your jaw joint. We'll check your muscles. We'll check what are called your lymph nodes, any lumps and bumps. We'll be checking your gums, your throat, the roof of your mouth, the floor of your mouth, your cheeks, the gums, the gum health, and the teeth and the way they come together. And we check for oral cancer. We screen for oral cancer. So it is important to go and get an assessment. Okay, so don't just think, oh, we check for teeth and we try and find work. Good dentists will do all of that assessment. All right. So when I finish an assessment with someone who maybe around their 40s, 50s, I might start saying, okay, so on top of the flossing, which cleans where the teeth touch, you might need to do something called interdental cleaning. And they turn around to me and say, I've never had to do that before. But what happens is, I was going to do some drawing, but I think if I just use my fists here, it'll work. So imagine these are 2 molars. In between, right, as a teenager, that gum goes right up to the top of where they contact. But over the years, we can get some gum recession. So you can imagine that triangle, which is just small, gets bigger. So this space here becomes more significant. So we get spaces between the teeth, which need additional cleaning. So on top of the brushing and the flossing, then we need to clean that triangle of space. If we do not clean that triangle of space, in fact, I will draw this because I think it is important. Give me 1 second while I just switch. Let's just get rid of this one. If you can't see it, let me know. Otherwise, I'll carry on. So let's not use red. Let's use some white. So here we have 2 molars at the back. Okay, we might have another tooth there. Let's go to another color. Okay, so as a teenager, our gum might be here. Okay, and then as we get older, we might get some recession, and then the gum drops down. And now we have this triangle of space, which is here. Okay, and the gum recession might even go to here. So in addition to cleaning with our brush and our floss, the floss cleans here, and the brush cleans all of this. This area needs to be cleaned. And normally we use something called bottle brushes. Okay, so this is now called interdental cleaning. I will just stop my share. Give me a second. Stop share. Okay, hope that made sense. So now we need to use what are called bottle brushes. Back in the day when we used to have glass bottles of milk, we use a bottle brush to clean inside. We can get these small bottle brushes and we can clean in between. And that should be done once before going to sleep as well. If not, we can get very deep decay. And if you get decay on the root of a tooth, sorry, let me go back to that. If you can imagine here, let's use another color, let's use black. If we get decay here, right, a dentist can do a filling like this, okay? But if you're leaving plaque now here and you get decay down here on the root, to try and drill that is very difficult. Normally, this cavity that forms very deep down on the root means that the tooth needs to be removed. Okay, so interdental cleaning is something that we have to stop share. Can't see your lovely drawing. Oh gosh, hang on, I didn't share properly. You're done. Screen, start broadcast. Thank you for telling me. Okay, so let me just undo that. Okay, hopefully you can see that. If you can't, let me know. So if we get decay here, it's a bit more manageable. You get decay because you're not flossing. You get decay like that. A dentist will drill that out and probably put a filling like this. Okay. Okay. But if you're leaving plaque here, the decay can go very deep on the root. Okay. And if you get decay on the root so low down, can you imagine having to drill all the way through like that? We have this nerve that sits like this as well. So normally if you get decay down on the root, the tooth needs to go. So I've just repeated myself, but hopefully you've seen what I meant there. Hope that was okay. So as an adaptation, we need to interdental clean as we get older, all right? Now, there's gingivitis, and then there's another gum disease called periodontitis, okay? Periodontitis is a non-reversible gum disease, okay? And there is genetically, South Asians, that means Indians, and Afro-Caribbeans are more susceptible to gum periodontitis, okay? So that means genetically we predispose to it. And periodontitis causes teeth to become loose, gum abscesses, and tooth loss, even though you've had no problem with the tooth at all, okay? So again, I'll go back to my drawing. Start forecast. Hope this is all useful. This type of thing I say all day long. So to me, it's repetitive, but hopefully it's really important to you guys. So we are now talking about something called periodontitis. Okay, so dont means tooth, perio, inflammation. And so perio means like these tissues which are around there. So we have gum, which is sitting three-dimensionally around the whole tooth like this, okay? And this is literally what I'll do with my patients. I will draw this so they understand. And then we have the bone, which sits under the gum like this, okay? With periodontitis, you get in that same inflammation of the gum where you get this bleeding, all right? But what's happening underneath is that the bone is dropping. This bone is going down, 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 down like that, okay? Let me just go back to drawing the rest of the tooth because that'll make more sense. So this tooth, imagine, has got roots like this. And then if we imagine this black line is the bone, can you imagine if you let this bone keep going down, that's the architecture that holds the tooth in place. And so you might not go see the dentist for 20, 30, 40 years, and then suddenly you start getting loose teeth. And this is why periodontitis is a silent disease, okay? Meaning you don't get very many symptoms, okay? You get some bleeding, right? But you don't get very many other symptoms. But what's happening, what you don't realize is that the bone is dropping down and down and down, and your teeth or your tooth is losing the scaffolding which is holding it in place, okay? So then these teeth become loose, and periodontitis cannot be reversed. We can do treatment which stops the bone from getting worse, but we cannot get bone to grow back, okay? So this is why it's so important to go to the dentist to have screening for gum disease, because we are looking for periodontitis. Because periodontitis, let me just give you an idea. In between your teeth, there is a certain amount of surface area. If you have periodontitis on all your teeth unknowingly, that represents the surface area of your whole forearm, okay? Your whole forearm. Now imagine you woke up and your entire forearm was bleeding. Imagine you had no skin and your entire forearm was bleeding. If you have periodontitis in your whole mouth, that means that amount of surface area is bleeding. Now, there is recent research that correlates gum disease with heart disease. And the reason why is because bleeding anywhere, because our blood vessels are part of a whole system, bleeding, inflammation anywhere causes inflammation anywhere else. Okay, so let's say that again. Inflammation anywhere causes inflammation anywhere else. Okay, so if we have inflammation in the gums, then the small vessels around the heart, the markers that are produced by the inflammation, you'll get inflammation around the heart. So you'll get cardiac disease. Not you will get, you can get cardiac disease related to gum disease. That doesn't mean that everyone who got gum disease will have heart disease. I'm not saying that, but I'm saying there's a higher chance that you can have heart disease from gum disease. Okay, so I just really want people to understand that, be aware of that, because this is latest research. So do get screened for gingivitis and periodontitis. Okay, and treatment-wise for periodontitis, 90% of the periodontitis treatment is you and your cleaning. There'll be a different way that you have to clean. Your hygienist will tell you how to clean if you have periodontitis. It's about using special interdental or what's called subgingival cleaning tools. They're essentially toothbrushes of certain shapes, but because now we've lost the architecture, remember what I drew? We have two roots like this. Imagine this is the tooth, these are the roots. Imagine the gum shrinks and shrinks and shrinks, and then now you've got a gap between the two roots. This is called the bifurcation. So that's where food can get stuck and you get a gum swelling. Okay, so you have to clean every day. If you've got that much gum recession, you have to clean in between those roots to reduce the chance of gum abscesses. Okay, so it is important then to have if you have periodontitis, then you will have to have a maintenance plan for seeing the hygienist regularly. And there's this, especially in the Indian community, I'm not going to see the hygienist because every time they do it, they make my gums bleed. But actually, your gums were already inflamed, and then they come along and clean everything, and then it's bleeding. But honestly, if you clean properly and thoroughly for 2 weeks, the bleeding will pretty much reduce to zero. So that's why I'm saying 90% of the treatment of periodontitis is you and your cleaning. The hygienist will do the other 10%, which is very important. So yeah, don't feel, sometimes we're thinking when we're cleaning that it's making it worse. It's not making it worse. We are making sure we're keeping the scaffolding strong. The gums are tight and not inflamed around the teeth. Okay, so I think I've really done that with the periodontitis. That's probably the biggest one I wanted to definitely share, because it is prevalent in Afro-Caribbeans and Indians or South Asians. So yeah, that's that. It's 9 minutes to. I was going to just talk a little bit about geriatric dentistry and cancer. Just really quickly go through that. Are we okay, Subranti? Yeah, we're nodding. Okay, cool. So old age, and I can come on again and talk about restoring and replacing teeth. I can do that as a separate talk if we need to. But again, geriatric dentistry, we've gone from Cormorum, Yorvanum, Jara, okay, geriatrics. Normally then, we might be in a stage where we've had tooth loss, and we can either choose to replace teeth or not. It is better to replace teeth, especially if they're functional, because it will help balance the bite and things like that. And it will stop tilting of adjacent teeth. It will stop other teeth, because teeth like to be in pairs. If it loses its partner, it tries to look for a partner, and the other tooth can overgrow. So replacing teeth is a good idea, okay? Replacing teeth can either be with implants, bridges, or dentures, okay? Those are the three ways we can replace teeth. So then there's a certain hygiene that goes with that. If you have a bridge, you have to clean in a certain way. If you have dentures, you have to clean in a certain way. Now, as we get older, unfortunately, we have loss of dexterity. Okay, so arthritis might happen. My Guru Maharaj, unfortunately, had a stroke, and one of my biggest concerns after doing a dental checkup was when patients either get severe arthritis, or they lose dexterity, or they lose function after a stroke, then they don't realize, but their cleaning reduces, right? Because imagine now, we used to clean every day like this, and then we need to clean even better. So sometimes if someone is severely disabled, then a carer can do the cleaning. So if you have parents, grandparents that have carers, then ensure that the cleaning, oral hygiene is part of it if they have lost their dexterity. Also, loss of memory can happen. Sometimes, people are forgetting to clean their teeth, and that's what we see. Someone who's gone their whole life, no problems, come for a checkup, and their mouth is, and someone's asked me, have you had anyone with really bad breath? Yes, like I've had the worst. I've seen the worst you can imagine. Okay, and sometimes it's someone who's got dementia, Alzheimer's, Parkinson's, something like that, and they're not cleaning. Okay, so please do make sure anyone you know has support, or if you yourself feel like that, then you reach out as well. Okay, elderly patients, as they lose teeth or you get tooth wear, you get something called overclosure, where we start getting folds. Sorry to do this. As we get older, we get folds in the corner of the mouth, and this area can get a fungal infection, which is called angular colitis. Angular colitis is a fungal infection. Normally, when we're sleeping, we have this fold. If the dentures are very ill-fitting or they're very worn out, we get folds in the corner of the mouth, and that causes a fungal infection. That fungal infection going in the mouth causes quite a lot of distress. It's constantly sore, and that can be solved very easily. So again, go see a dentist for that. Are there any Ayurvedic treatments for your gum health? I knew people asked about this. What I'm not going to cover is oil pulling and making your own toothpaste. These are all valid. I would say if you are oil pulling with coconut oil, then spit it down the toilet pan or the commode, not down your sink, because as you know, coconut oil will go solid again and you have a blocked sink. That's as far as I'll probably say that. I have asked my professor that I work with to look into oil pulling, because the sublingual area under the tongue, if anyone knows about GTN sprays and angina, that is the quickest way to get things into the system orally. It's under the tongue. So when we do oil pulling, it's reducing toxins, inflammation. That's the theory behind it. So yeah, I probably need a separate Ayurvedic thing, but nothing beats nothing beats brushing the plaque, what we call biofilms, because this plaque, if you leave it long enough, it can turn virulent. All we have to do is break up that plaque, and it reduces virulency and reduces the disease process. Okay, so we've done Komaram, Yovanam, Jara. I want to just talk about cancer, because it's very important. We, as dentists, screen for oral cancer. We check for lumps and bumps, make sure there's no transfer of cancerous things into the lymph nodes. Just because you have a lump or bump does not mean you have cancer, but it is good to get things checked out. We are looking for white patches. We are looking for red patches. We're looking for red and white patches mix. We're looking for raised tissue. We are looking for painless swellings, painless ulcers, ulcers that have persisted more than 2 weeks, a hoarse throat. These are all signs of what we can say pre-malignant conditions maybe, or signs of potential cancer. Just because you've got a hoarse throat doesn't mean you have cancer. It might just be that you're screaming in a kirtan for too long. So don't just think because I've got a hoarse throat, I've got oral cancer. But a persistent thing like that, you should definitely get checked out. Another one I wanted to talk about was submucosal fibrosis. So submucosal fibrosis is a pre-malignant condition. What a pre-malignant condition is a condition that can potentially turn into cancer, more so. And when people eat pan, especially pan that's got tobacco in it, supari, and they leave it on the inside of their cheek, they get a condition called submucosal fibrosis, and people can't open their mouth very far, okay, like this, because the inside of their cheek has gone fibrous. And that is a pre-malignant condition that can lead to oral cancer. So please don't chew pan, please don't chew tobacco, please don't keep it in the inside of your cheek. And if it's very rough on the inside, then please do get that checked out for submucosal fibrosis. The main cancer that we look for is squamous cell carcinoma, which is a very, very horrible cancer. And it needs to be detected and removed as soon as, because it can grow very rapidly, and the mortality rate, is very high with that. people don't survive more than 5 years. So that is what we are screening, especially as we get older. We look for that. I'm not saying all this to scare you. I'm saying it because I care for you. I care that you all do look after your oral health. Right, I will stop here. Let me just look at some of the questions. Could spicy food have bad effect on mouth or teeth? Spicy food, well, certainly it will make inflammation happen. If you imagine, when you have something spicy, it inflames your mouth. And as it goes down your gut, it inflames all of your gut. So, you know, it can cause irritable bowel syndrome. You know, people are addicted to chili, things like that. Can cause ulceration. Yeah, so very spicy foods. Obviously, that's rajasic from our point of view. We don't have overly spiced foods. It is always good to have a little bit of green chili because, you know, that actually has a cooling effect on the body. So Granthi, it was through a general dental checkup. My dad was diagnosed with mouth cancer, had no symptoms. Cannot stress how important dental checkup is. Yes. Yeah, I mean, I've caught mouth cancer a few times in patients, and thankfully, when they've had the cancer removed, like they've been able to live, you know, a better life. And I've actually seen patients when they've caught a mouth cancer, they've decided not to have treatment, and the demise has been terrible. So yeah, even if you know, just from this one talk, you get a checkup and reduce all of that, then reduce the chance of it, and then I've done a good job. So do we arrange dental checkup camps for devotees? So I'd like to probably pass back to Sukranti Radha. Thank you for all your kind words that I can see coming through. I want people to stay connected because the talks that are done here are really good. We have talks on, just off the top of my head, we've had talks on well-being, dementia, Alzheimer's, neurodiversity, so many other things. So please stay connected with Sukranti Radha. I'm going to go on mute. You can just go onto my Instagram. I'm either there as Ink Stains for Your Brain or Dr. Jay Pankani. I have 2 accounts. Just send me a message on there, and I will, in my own time, respond to you. But definitely, definitely go and have a checkup done. That is the main thing I would say. So I hope that's been useful. Sukranti, I'll pass back to you to close. Hare Krishna.
Yeah, thank you so much, Balaram Prabhu. That was extremely helpful. I think everyone will agree with me. So many wonderful points you touched upon, which, you know, sometimes if nobody tells you, you don't know, that kind of thing. So it's really been extremely helpful. And we have so many things we have taken away from your topic, so which is like really, really, really good. Thank you so much. And we'll be having more. We hope we're gonna have you more on other topics as well, because dentistry is quite a wide topic, and so we'd really like to hear more on other things, different parts of dentistry. But at least you know, this is a great start, because at the end of the day, we are all devotees and we all chant. It's very important for us to know how to keep our mouth as an altar. And if we don't know how to clean, like you've stressed so much today, the importance of cleaning, then we would not know how to create this altar in our mouth. So it's very important that we learn the basics from you. And as a nurse, trust me, when I look after patients, there are so many patients who don't know how to brush their teeth.
Mm.
It's like that. So it's a very interesting topic, with something we do every day, but we don't know how to actually do. So topics like this really help us to understand all of this. So thank you so much. And so we'll be having more talks on this. And then in 2 weeks' time, we've got Pragosh Prabhu coming. And then we've got, I think, every 2 weeks we will have somebody. So if there is no other questions, then we can close. And this recording we will place, I will let you all know in the communication where we'll be now recording and placing our topics, if that's okay.
So Granthi, whoever's come on new for the first time, how can they stay in contact or stay in touch with your healthcare professional network?
Yeah, so the ISKCON UK Health and Wellbeing kind of WhatsApp group, they can join the WhatsApp group. If you don't want to join the WhatsApp group, all these talks are always posted on the ISKCON UK social media, as well as the Euro RGB social media, because it's open to UK, Europe, and South Africa. So you can join there. So you either join the WhatsApp group or just stay on the social media for ISKCON UK, and you'll be able to know when's the next talk. We always advertise at least a few days before, so you don't forget. So at least. Yeah.
Thank you.
Yes. I don't. Is there
So,
any?
I will stay. I will stay on because there's some people just asking questions. I'm happy to
Oh,
just
yes, yes.
some of these questions, and then
Sure.
maybe 5-10 minutes. If people want to leave, they can leave. But otherwise, if you want to just ask questions, I will just answer. Is that okay?
Yeah. Absolutely. Yeah.
Okay. So how do we brush our teeth? Is medium tooth? Go on. Yeah. Sorry. Go ahead.
I'll just put my number on the line because I think people are asking about the WhatsApp group. If you text me, and I will add you to the group.
Mm-hmm. Okay, so someone used how do we brush our teeth? So I talked about the modified Bass technique, which is making sure we clean at the gum tooth margin and obviously all the rest of the surface, the biting surface, the inside surface. I would say yes, use a medium. Don't use a hard toothbrush because that causes tooth surface loss or tooth abrasion, we call it. Sometimes we have very overzealous kind of patients who overbrush almost out of fear of, I don't want to have problems. But the outside layer of enamel is like glass, it's inert. If we overbrush that, we get rid of that and it exposes the underneath part, which is called dentine, and that is very sensitive. So more like a medium, soft to medium brush, but just thorough brushing. Think about each tooth as a gem that you have to clean rather than all your teeth as a wall you have to scrub. This is what I say to my patients. That in itself will change the way you brush your teeth. Hope that helps. So that's a Zoom user. I don't know the name. What about bamboo toothbrushes? Are they not too soft? Yeah, you'll have to just, again, check. Just make sure you are feeling like you are clearing all the plaque. You know, use them and by all means go back to the hygienist and see, you know, is this the right one for you? I don't want to give dogmatic advice, but yeah, definitely I've used bamboo brushes. At the moment, I'm using recycled plastic toothbrushes. I did find the bamboo toothbrush was a bit soft. I do agree with that. But also what was happening is the bamboo was rubbing on the inside of my lips and causing my lips to be a bit sore. So maybe that was just the finish of that bamboo. It wasn't so smooth. So yeah, definitely look into it. I just hate the idea that every single toothbrush I've ever used is in some sort of landfill site somewhere. So if we can use more sustainable products, it would be good. Okay, cool. Thank you, David Krishna Das. Okay, so if there's no more questions, Sugandhi Radha, yeah, we'll close.
Yes. Thank you so much, everyone. And we look forward to seeing you all again on the next talk. And thank you once again to Balaram Prabhu for an amazing talk and have been wonderful, wonderful takeaways from today. Thank you so much. All glories to Srila Prabhupada.
Thank you. Thank you, everyone.
Thank you. Hare Krishna. Thanks.